Okay, so this safety presentation is on bloodborne pathogens. This is a subject that OSHA takes a very serious look at when it comes to employer compliance. So the three things we're briefly going to touch on this morning is that we're going to define some common bloodborne pathogens. We're going to identify and recognize some OSHA standards related to the pathogens. But the big thing we're going to cover is the employer responsibilities related to compliance when it comes to the standards that OSHA has in place. So the OSHA standards for bloodborne pathogens came into effect in March of 1992. It basically covers all occupational exposure to any blood or any other potentially infectious material. So the purpose of this is to reduce the risk of bloodborne pathogens that you may encounter in the workplace, and it's primarily here to protect the employees. What a bloodborne pathogen is. It's a microorganism that's present in human blood or any other potentially infectious material, and that microorganism could potentially cause disease in humans. It can be a virus, it can be a bacteria, or any other microorganism. It's carried in the bloodstream or other materials and could have some serious health effects. So there are over 20 different bloodborne pathogens. They include, but are not limited to, some of the more common pathogens are going to be hepatitis B, hepatitis C, and then the HIV virus. There are some additional bloodborne pathogens that could come into play. It could be malaria, syphilis, brucellosis, what they call arboviral infections. There's also relapsing fever and viral hemorrhagic fever. You primarily see those types of pathogens in underdeveloped countries. There's also the potential for what's called Creutzfeldt-Jakob disease. That is a bloodborne pathogen that is primarily found in young children. Why does OSHA have a big concern over these bloodborne pathogens? Well, OSHA estimates there are over 5.5 million workers in the healthcare field and other fields that are at risk to exposure for bloodborne pathogens during the course of their normal duties. How does someone contract a bloodborne pathogen? Primarily, a bloodborne pathogen is going to enter your body through a break in what they call skin integrity. That could just simply be something as a scrape or a cut. It could be maybe where you have an ingrown toenail, ingrown fingernail. It could also come from a potential needle stick. This is why you see first responders always wearing gloves now, especially police officers when they're patting down someone, because there's the potential for a needle stick there. The pathogens can also enter the body if they are splashed into a mucous membrane. So if you were to get some sort of bodily fluid splashed around your eyes, your nose, your mouth, those pathogens could potentially be absorbed through those membranes into your bloodstream. They also enter the body through various lifestyle activities, and the big one in that area is going to be IV drug use. What are some of the symptoms for bloodborne pathogens? For example, hepatitis B mimics the flu. You're going to see a lot of flu-like symptoms, including fatigue and fever. You could also see potential weight loss and diarrhea. Hepatitis C, once again, largely is going to mimic the flu. For the HIV virus, you are going to see some flu-like symptoms, but you will also see fatigue and night sweats, and you could also see some opportunistic infections that get into your bloodstream simply because your autoimmune levels are lowered. If you're out working here, let's say you're working out here on the floor and one of your coworkers slips and falls, gets a cut to their scalp, and they start bleeding. What's the first thing you're going to do? You're going to put some gloves on. You're going to get some type of PPE on before trying to administer any type of first aid or assistance to that employee. OSHA requires employers to have what's called an exposure control plan. This plan basically lays out the dangers that employees could face if they come into contact with blood or infectious materials as a result of their regular job duties. One thing that OSHA does make an exception on is what they call Good Samaritan acts. So if you're assisting a coworker, like if with a nosebleed, that's not necessarily considered occupational exposure because it's not directly related to your job duties. Occupational exposure, where that comes into play as far as OSHA is concerned, is if your job duties include direct patient care, if you're in the healthcare field, if you're working in a lab, but if you're also working in environmental services, if you're working in waste management, so if you're cleaning out trash cans or other sort of waste receptacles, or any other regular job duties. The exposure control plan lays out a schedule and methods for how employers remain in compliance, what type of evaluations and follow-ups that they need to do if there is an exposure. It also spells out labeling and training procedures and also record keeping. Why we want to tell people that you need to wear PPE if you have a coworker maybe that has suffered some sort of cut or injury and that they're bleeding, is that they want to ensure that the standard universal precaution is followed. That universal precaution is any human blood and bodily fluids are to be treated as if they were known to be infected. You cannot assume that anybody's blood or bodily fluid is automatically clean. They want you to assume up front that there is some potential danger there. The methods of compliance are also going to cover any engineering and work practice controls, PPE, and housekeeping, and we'll go over PPE in just a minute. The work practice controls, the purpose for those are to eliminate and minimize employee exposure. They want to see readily accessible hand washing facilities. So if you have those hand washing facilities, even in a break room, that's great. They want you to keep food and drinks out of the work area. If part of your job duties involve any type of handling of blood or any other bodily fluids, those work controls are also spelled out in the Code of Federal Rules citation that you see at the bottom of the slide. It also deals with two other big areas. That is contaminated equipment and contaminated sharps management, which we'll cover in just a second. Examples of engineering controls: spill kits. We've seen numerous departments go out and actually buy spill kits now. They look like larger versions of first aid kits, but the spill kits are going to have gloves, either latex or rubber, probably some sort of hand sanitizer, wipes. It may even have some diluted bleach in there as well. Also, the other examples are hand washing stations. That also includes eye washing stations as well, if you have those, and also red hazardous waste bags. We've seen the parts department really take a proactive approach now and actually purchase red hazardous waste bags because they are doing so much in terms of waste management and cleaning up after waste. They're finding syringes, hypodermic needles in restrooms and in other facilities throughout the city. Those things cannot be disposed in general waste. They need to be handled separately, so they put them in the hazardous waste bags and they mark them as hazardous waste. Hand hygiene really is just a lot of common sense. That's just appropriate techniques and just reinforcing and reminding individuals that just wash your hands after coming into any type of direct contact with potentially infectious material, after using the bathroom. If you're caring for someone, maybe if it's a patron that comes into the library, you also need to make sure you're following proper hand hygiene. If you have the alcohol-based hand cleansers, that's great. Purell or any types of those alcohol-based cleansers, use those regularly. And also, if you just don't have any soap and water available, also use those hand cleansers. You need to get them into all surfaces of your hands until that substance dries. That's even including in the crevices between your fingers. Use it before and after meal breaks, maybe if someone's coughing or sneezing, even after you remove gloves. If you are wearing the rubber or latex gloves and you take them off, it would actually be sensible to go ahead and use that hand sanitizer. One of the big things that OSHA looks at when it comes to work practice controls is PPE. OSHA has stated that employers are going to provide appropriate PPE at no cost to employees. That includes gloves, face shields and masks, eye protection or safety goggles, pocket masks, mouthpieces, and even lab coats or gowns. And those are just a couple of examples. The blue gloves are primarily going to be the rubber gloves, not the latex gloves. We do recognize that some individuals might have an allergic reaction to latex, so that's why we also encourage folks to get the rubber gloves as well. And then you also see the paper masks. We'll kind of go over some more PPE in a minute because the OSHA regulations also cover cleaning, laundering, and disposal of PPE, how to remove PPE before leaving the work area, and what to do if there's any penetration of the garments. When it comes to housekeeping and environmental services, they want the work site to be maintained in clean and sanitary conditions, making sure there's also safe disposal of any items. Regulated waste. This is where the contaminated sharps comes into play. Regulated waste has to be separate from general waste. One of the things that we're seeing certain departments do now when they're coming across contaminated sharps is that they're actually getting these sharps containers. These are the plastic buckets that you see in medical offices, like in exam rooms. Some of the departments and parks are actually using these now because they're finding syringes in the bathrooms. That is actually an OSHA approved container. What they'll do is that they'll put those sharps in the container. Then they'll typically empty those containers when they get about 3/4 full. What needs to be done when those containers are emptied and removed is that they need to be taped closed. And if there's any type of leakage that is noticing, if they're seeing any type of fluid that is leaking out of that container, they can always take that container and place it in a separate container, just to make sure it's kind of double bagged or double sealed to make sure that none of that fluid leaks out. And then what will happen is that that container will be sent off. It'll be properly cleaned and sanitized so we can come back to that department to be used again. When it comes to the other regulated waste, it also should be labeled and color-coded if possible prior to its removal. There are going to be certain times maybe where you're not going to have access to the red hazardous waste bags. If you can just use regular waste bags but double bag it and then just label it, you can just simply put a Post-it note on there that says this is regulated waste, not general waste. And then what you should be doing is contacting probably someone in Public Works, because they can come out, take that waste away to make sure it's sent off to a separate facility for disposal. And like I said, the regulations state that you cannot mix medical waste with general waste. That also includes the syringes and hypodermic needles. You should never ever place your hand in a red bag or a sharps container to retrieve an item. The reason why contaminated sharps get so much attention is that in 2001, OSHA enacted this public law. It's called 106-430. It's called the Needle Stick Safety and Prevention Act. Back in 2000, OSHA did a study nationwide, and they determined that there were over 300,000 injuries in the workplace when it comes to contaminated sharps. That's people getting stuck with needles. If it's a police officer patting down a subject, if it's a firefighter maybe trying to resuscitate someone, there were all these injuries coming about because of needle sticks. So that's why this law was enacted. The law requires organizations use safer medical devices now with injury protection or needleless systems. This is why now when you go to the doctor, if they take your blood, you basically get the little prick on your finger now. That's a needleless system. And once that device is used, it's thrown away, it's put in the contaminated sharps box, and it's not used again. There's also the need to reflect the changes in technology that can help reduce the exposure to pathogens, and it also helps document the consideration and implementation of any safety devices. What would happen if a city employee gets a needle stick is that the city would have to maintain what's called a Sharps injury log. And that basically is going to note each incident, the type of brand of device that's involved, which department it occurred in, and how the incident occurred. And then one of the work practice controls that comes into play is that the employer would actually have to solicit input from non-managerial staff when it comes to evaluation and selection of any work practice controls that could reduce that exposure in the future. What that means is that they're going to go to the frontline employees and ask them, what could we do going forward to prevent that? And all that input is going to come from non-managerial staff. That's pretty much just kind of a generic poster you see when it comes to Sharps safety and how it's used a lot in the medical field. Contaminated laundry. It should be handled as little as possible. So if you are dealing with a patron here at the library and somehow that patron maybe gets some drops of blood on one of your work shirts, that shirt should be handled as little as possible. If it is possible, you need to get that shirt off and get it bagged or put in a container at the location where it was used. Once again, put it in a bag and label it, and then try to ensure that that bag is leak proof. If that means double bagging it, that will work just fine. The city's required by OSHA to ensure that employees who have contact with contaminated laundry wear the protective gloves and any other PPE if you're handling it. So even if you're putting it into a bag to seal it up, you still need to wear the gloves and safety goggles or whatever you want to wear. What will happen is that that laundry will actually be sent off to an off-site facility to be properly cleaned and sanitized before it's returned to you. The next section is about the hepatitis B vaccination. So OSHA mandates that employers make hepatitis B vaccines available to all employees who have a potential occupational exposure. So if you have not had a hepatitis B vaccine, get with your supervisor and then have your supervisor get in touch with the Wellness Center down on 11th Street. You can go down to the clinic and get a hepatitis B vaccine free of charge. It's good for 5 years. If there is an exposure for a city employee, the city's required to do a post-exposure management. What that management includes is that there's going to be follow-up care and evaluations done for that employee. It's going to be done at no cost to the employee. If you go down to the clinic and get follow-up care, there's no co-pays. There's no deductibles that you're going to pay. If you are referred to any type of outpatient specialist, they're also going to try to ensure that there's no cost to the employee. It's going to be done in a reasonable time. It will obviously be done by a licensed physician or healthcare professional. If there are any lab tests that need to be done, the tests are going to be done by an accredited lab at no cost to the employee. Some of the other evaluation steps that are going to take place. There's going to be a documentation on the route of the exposure, a documentation if it came from an individual. There will obviously be collection and testing of blood done for bloodborne pathogens. There's going to be some counseling, any evaluations of reported related illnesses. There can even be a post-exposure prophylaxis and care. Basically, what that means is that if you had any type of blood or bodily fluid splashed in and around your mouth, the city will pay for you to go to a dentist or a dental provider to get your teeth cleaned. There's also going to be communication of any type of potential hazards that will be done to employees. That includes labels or signs. That's one thing that OSHA will always take a big look at when they come in and do an audit. We try to take a look at labels and signs on an annual basis or when any type of changes occur. When it comes to record keeping, if you do any type of post-exposure evaluation at the Wellness Center, they are going to maintain your medical record for the duration of your employment and then 30 years after you leave. That is an OSHA requirement. As part of the safety team here, we will keep dates of training sessions. We'll keep contents and summary of any types of training materials. and we'll have that information input into the LMS, so there are electronic records kept of any type of training sessions and who attends. And we will maintain those records for 3 years from the date of the training. So because when OSHA comes in and conducts an audit, one of the first things they normally ask for is that they're going to ask for copies of training records to see if you've been trained. We do not have 100% compliance when it comes to bloodborne pathogens in the city. That is just mainly due to schedules. It's also a decreased awareness of hazards, but it's also mainly just due to lack of resources. We only have a couple of people in the city really that are trained on how to get people trained on bloodborne pathogens. This is just some common signage that you're going to see when it comes to pathogens. It's going to just talk about being aware, making sure you use labels. If you're using the PPE, especially any type of disposable PPE, like the latex gloves, make sure you remove them. The best way to remove latex gloves, if you have them on, is that you're going to take them by the lip, down by your wrist, and you're actually going to pull them to where they're inside out when they come off your hand. And then you can dispose of them in the disposable containers. We really try to impress on people, wear the PPE even when doing minor stuff.